In today's video, I'll be telling you why you keep getting BV and how to stop the cycle. You treat it, it goes away. Then a few weeks later, it's back again. The itching, the smell, the weird discharge, it's like a bad ex that just won't leave you alone. If you've ever asked yourself, why do I keep getting BV? This video is your answer. I'm going to break down why bacterial vaginosis keeps coming back, what might be sabotaging your treatment, and how to finally break that cycle for good. First, what is BV? BV stands for bacterial vaginosis, and it's the most common vaginal infection in women of reproductive age. It happens when the natural balance of bacteria in your vagina shifts, specifically when the healthy bacteria called lactobacilli drops and other bacteria like Gardnerella vaginalis takes over. And no, this isn't about poor hygiene. You can be shower fresh and still get BV. There are classic signs of BV, and this is what I want you to watch out for. Gray or thin discharge, strong fishy odor, especially after sex, mild itching or burning, and sometimes no symptoms at all. It's easy to confuse with a yeast infection, but the two are not the same. BV doesn't usually cause thick discharge or intense itching like yeast does. So why does BV keep coming back? Let's talk about the 6 biggest reasons. 1, you're treating the symptoms and not the root cause. So most people with BV are given antibiotics like metronidazole or clindamycin for the BV, which will kill off the overgrown bacteria. But they don't rebuild your healthy vaginal flora. So yes, the bad guys are gone, but so are the good guys. So that leaves the vagina vulnerable to reinfection. So without restoring that balance, BV is likely to return. 2, your vaginal pH is out of whack. A healthy vaginal pH is slightly acidic, around 3.8 to 4.5. This acidity keeps harmful bacteria in check. But then again, things like semen, which is alkaline, douching, harsh soaps, menstrual blood can all raise your pH, making it easy for BV to grow. The third one is sexual activity. BV is not officially a sexually transmitted infection, but sex can absolutely trigger it. This is why it is called a sexually associated infection. BV is associated with sex because semen raises the vaginal pH. New or multiple partners can introduce unfamiliar bacteria. Oral sex and even fingers, if it's not clean, can shift your flora. You don't need to abstain from sex forever, but protective strategies make a big difference. We'll get to that shortly. 4, hormonal fluctuations. Your estrogen levels influence vaginal mucus, pH, and the growth of lactobacilli. That means that hormonal birth controls, perimenopause, that is around your menopause, and PCOS can all play roles in BV recurrence by changing the vaginal environment. And 5, douching or using scented products. Douching is one of the fastest ways to mess up your vaginal microbiome. Same goes for scented wipes, vaginal washes, perfumed panty liners or soaps. Even though they are marketed to make you feel clean, they actually strip away the good bacteria you need to stay healthy. And 6, you're not treating your partner when you should be. Hold up. The current guidelines don't recommend treating male partners for BV since the evidence is mixed. But female partners of women with recurrent BV, that's a different story. Treating both people may reduce the recurrence in same-sex couples. So if you're in a relationship and BV keeps coming back, it's worth discussing with your doctor. So how do you break the cycle? 1, finish your full course of antibiotics. Even if your symptoms go away early, don't stop your medications. Stopping early can lead to regrowth and antibiotic resistance. 2, rebuild your vaginal flora after treatment. You cleared out your overgrowth, right, with the antibiotics. Now you need to repopulate the good bacteria by using things like probiotics, specifically the ones with Lactobacillus rhamnosus or Lactobacillus reuteri. These strains support vaginal health, and you can take them orally or vaginally. Always check the brand directions. Try vaginal boric acid suppositories. Some people use these after antibiotic treatments to help stabilize the vaginal pH and prevent recurrence, but only use it under medical guidance, especially if you're pregnant. 3, avoid triggers. I'm going to give you your do not disturb list. No douching, no scented soaps, wipes, or bubble baths, no deodorant sprays down there. Minimize use of tight, non-breathable clothing. Wipe front to back after peeing, always. Change out of wet clothes or sweaty underwear quickly. Your vagina is self-cleaning. It doesn't need help, just support. 4, be strategic about sex. If sex triggers your BV, use condoms. Use condoms to minimize the pH changes from the semen. Wash your hands. Wash hands and toys before use. Urinate and gently rinse after sex. Consider a short course of boric acid or vaginal probiotic post-sex, but you need to ask your doctor about this one. Some women can even use suppressive antibiotic therapy if BV keeps recurring after intercourse. And the 5th one is that you can consider long-term strategies for recurrent BV. If you've had 3+ episodes in a year, talk to your provider, your healthcare provider, about suppressive therapy, low-dose metronidazole gel. Use 2 times a week. Switching birth control if that's contributing to your BV. Testing and treating your partner, especially if female. Diet and lifestyle tips. This can help, like if you limit your sugars and refined carbs, because high sugar levels can promote yeast and bad bacteria. Eat fermented foods like yogurt, kefir, kimchi. These are all natural sources of probiotics. And stay hydrated. A healthy mucosal lining starts with good hydration. Reduce stress. Chronic stress can suppress immunity and throw off your body's balance, including microbiome. BV is frustrating, no doubt about it. But with the right combination of treatment plus prevention, you can stop it from coming back again and again. So remember, you are not dirty if you have BV. This is a medical issue and one that's more common than you think. So once you understand your body, avoid the common triggers, and working with your doctor to rebuild your healthy flora, you can finally break the cycle and get back to feeling like yourself again. If this video has helped you, give it a like, hit the subscribe button, and let me know in the comment section if BV has been part of your journey. I'd love to hear your story and share tips that work. Take care of you. Thanks for watching, and I'll see you in my next one.